Hi, everyone, and welcome to our Prenatal Wellness Talks. Today, we will talk about how our well being can be impacted by trauma, both in childhood and in our current circumstances. And I have the pleasure to have with me today Liz McGregor. Thank you so much for joining us.
You're very welcome.
So, Liz, tell us a little bit about yourself, about the topic that you are delivering us today.
Okay, well, my name's Liz McGregor. I'm a nutritional therapist, a naturopath, lactation consultant, and a wellbeing coach. In my working life, I have two key areas of focus, which is preventing ill health in the first place, working with parents and babies, and helping people recover their health from chronic illnesses, working with adults. So I did a degree specialising in developmental psychology. I qualified as an international board certified lactation consultant, IBCLC, and also worked in a child development research unit. So I am deeply concerned about the impact of undernutrition on babies and their parents from preconception, pregnancy and beyond. And I'm also concerned about the birth environment, a depleted microbiome and developmental trauma. So I love to work with health professionals like you, because once you know the impact and what you can do to prevent and mitigate the effects of trauma, you can make a significant difference in people's lives every day.
And
So,
a little bit about what is this is your interest about trauma, and that's such a wonderful thing that it's bringing us together today.
um, I've, well, as I say, I was always interested in developmental psychology and the the way that what goes on in the family can impact the way the child behaves in the rest of life. So I was always interested in making it better. Uh, my own childhood wasn't particularly traumatic, but it wasn't that great. And I wanted to learn far more about how we could make it better for children and how particularly health professionals can make a difference just by being skilled, by being kind, by being compassionate and supporting personal resilience. So that's one of the reasons I'm here.
And what are the learning outcomes? What are the learning outcomes on this matter?
Okay. Well, I my aim is that you will understand much more about the causes of trauma and their effects. You'll have a much more nuanced and empathetic understanding of mental health issues and addictions, and how maternal nutrition can impact the risk of, for example, perinatal depression and anxiety. There's a big connection between the trauma in the parent and brain development in the infant, which I'm going to be talking about. There are loads of practical strategies to help to prevent prenatal trauma and mitigate, particularly prenatal trauma, and prevent perinatal and postnatal trauma for the parent and the infant. Particularly, these are skills that that this audience will be most interested in. There are life skills that the clients can use for themselves, and also, where to signpost traumatized clients for community support and more specialist help. So I want you to go away with an understanding of how important the role of prenatal and birth personnel can be in shaping the future of infants and their families, and the wider impacts on community and the world.
Yeah, I love that you are including this pre and perinatal trauma not only in the mother and the baby, but also on partners, families, and communities in society. And that is wonderful that we are going to be able to take some practical outcomes from this interview today. So, what trauma might a pregnant person or a couple be living with?
Well, it's not just the mums, it's also the dads or the partners. The research that was done on the original adverse childhood experience studies found 7 categories of adverse childhood experiences. There's psychological, physiological, or sexual abuse, violence against the mother, living with household members who are substance abusers, mentally ill or suicidal people, or even people who had been imprisoned or were imprisoned. So more than half of respondents, and these weren't people living in ghettos, these were just ordinary people holding down jobs, doing responsible stuff. More than half of those respondents reported at least one of these childhood traumas. 25% reported 2 or more. So if you think about that, 1 in every 4 people you meet has had at least 2 or more adverse childhood experiences. People who had experienced 4 or more, compared to those who had experienced none, had 4 to 12-fold increased risks, health risks for alcoholism, drug abuse, depression, and suicide attempt at least. They had a 2 to 4-fold increase in smoking, poor self-rated health, likelihood of many sexual partners, sexually transmitted diseases, and basically a 1.5-fold increase in physical inactivity and severe obesity. And so the number of categories of adverse childhood experiences showed a graded relationship to the presence of adult diseases, and those included coronary heart disease, cancer, lung disease, skeletal fractures, and liver disease. And all those early experiences may also set people up for later trauma and a repeat of less healthy relationships. So there is a very strong evidence that childhood trauma skews the immune system towards more inflammatory reactions. And so this highlights how trauma confers a physiological vulnerability to developing psychiatric and physical disorders in later life. And it's worth thinking about that trauma that is incurred within relationships is generally much more difficult to treat than trauma resulting from, say, traffic accidents or natural disasters. So if the people who you'd naturally turn to for care and protection terrify, reject, or ignore you, then you're more likely to learn to shut down and ignore what you feel in your body and your emotions. Now, this can lead to a loss of a sense of self, emotional numbing, living in the head, and a loss of sensation in the body. You may come across clients who have cut themselves in the past, or may still be cutting themselves, or using other forms of self-damage just to feel something and to get them into the present moment with that feeling of pain.
Mm-hmm. And what we need to understand more deeply about this addiction problem.
Yeah, well, as long as their map of the world is based on trauma, abuse, and neglect, people are likely to seek shortcuts to oblivion. For each emotionally traumatic childhood circumstances, there is a 2 to 3-fold increase in the likelihood of early alcohol abuse, because the brain development was sabotaged by the traumatic experiences. The dopamine and the opioid circuits in the emotional brain and the stress apparatus, the impulse control areas of the cortex, they just can't develop normally when children are deeply stressed. So addiction is a deeply ingrained response to stress and an attempt to cope with it through self-soothing. We know it's maladaptive in the long term, but also probably from personal experience, we know it's highly effective in the short term. Anybody who has a glass of wine after a stressful experience can know that. So I'm wondering if this makes you feel slightly differently about, for example, the drunken people you see, or people living on the streets. You can ask yourself, what happened to them as infants and young children? What was their mother's pregnancy like? What circumstances did they grow up in?
Yeah, I like your perspective in terms of observing what is happening in childhood. And now let's go to the origin, to not only the infant part of their lives, but also to what happened in their own pregnancy, the pregnancy of their mother. So what are the physiological effects on the brain of trauma?
Well, trauma, in fact, impacts the brain in several ways. And I'm going to give you a little bit of background here. That hormones and neurotransmitters, they're different words for the same thing. They're used to describe signaling systems in the body. If it's made in the brain, it's called a neurotransmitter. If it's made, say, in the ovaries, it's a hormone, but they both act in the same way. There are many different cell types with receptors for those, and a traumatized client's serotonin, which is a calming, relaxing neurotransmitter, and oxytocin, which you all know about, the love and connection hormone, those pathways can be disrupted or low. And the cortisol, the stress hormone, and the vasopressin, the blood pressure increasing hormone, those might be significantly higher than normal. And let's just mention the vagus nerve. It's a very long nerve that connects the most basic evolutionary physiological control mechanisms within the brain, from the back of the brain, such as heart rate, breathing, and blood pressure. And that goes all the way down to the rest of the body. And it connects the brain with all the major internal organs. It's part of the autonomic nervous system, the controls and balances that maintain everything from arousal and panic in the sympathetic branch to digestion, calm, and sleep in the parasympathetic branch. Now, the weird thing about the vagus nerve is that although it goes from the brain to the body, most of the fibers are actually going straight up to the brain from the body. 80% of those, it's not the other way around. So it means that what the body perceives, such as gentle touch, that leads to feelings of safety, and sudden noise leads to feelings of threat. So we feel first in the body and we think about it later. And babies and children can only feel. They tend to store traumatic memories as feelings and reactive tendencies without understanding them or being able to rationalize them. So feelings of threat can change the signaling overall to create a hypervigilant state, changing the nerve pathways and the hormone outputs and behavior. So the rational, analyzing part of the brain is centered on the prefrontal cortex behind your forehead. Now, that has no direct connections with the emotional brain, which is deep in the amygdala, in the center of the brain, where most of the impacts of trauma are stored. However, there's a medial prefrontal cortex, to get a bit technical here, which is the center of self-awareness. That's the part of the brain that's not really switched on in childhood, but becomes more active as we get older. That notices what's going on inside us and allows us to feel what we're feeling. So the neuroscience shows us that the only way we can change the way we feel is becoming aware of our inner experience in both body and mind, and learning to befriend what's going on inside ourselves.
Yeah, really interesting, the connection that you are having, and it's wonderful that you are explaining also scientifically the connection between what we feel in the body and what we experience in our mind. So what is the impact might this trauma have in our lifestyle, in our life load?
Yeah, so people may well have difficulty regulating anxiety and many other emotions, anger, depression. They're far more likely to be troubled with the addictive tendencies, and they're likely, in terms of life load, that's just sort of like how much is going on. They might struggle when they have a lot going on and react with anxiety or depression or panic, all of those aspects.
And what does all of this means to pregnancy, for pregnant mothers, for their own care?
Yeah, well, it does have an impact on the babies. So, the stress that the mother's going through has an impact on the baby, which is why one of the reasons we're getting this information out there, so that birth professionals, in the Prenatal Alliance, can be aware of this before the baby's born and help make a difference to it. So the babies of mothers who are stressed in pregnancy have high levels of stressful cortisol, lower levels of essential neurotransmitters such as serotonin and dopamine, and that mirrors what's going on in the mother. So those transmitters play key roles in mood regulation, impulse control, attention, motivation, and the modulation of aggression. So these lower levels have also been found, they're implicated in learning, behavioural and mood difficulties. So these newborns had less developed learning skills. They were less responsive to social stimulation. They were less able to calm themselves when agitated, and they were more vulnerable to depression and anxiety as they got older. So basically, they're harder to soothe, and they're more difficult to parent in a rewarding way, because they are much more tense and much harder to soothe. And the impact later on is that, for example, if their mothers were diagnosed with post-traumatic stress disorder or depression, when those children were followed up, they were 6 times more likely to have significant emotional problems and 11 times more likely to become hyper-aggressive. And it's not just about what's going on for the mothers and the babies. The impact of the paternal side, has a significant difference. A large Swedish study showed that paternal depression raised the risk of extreme prematurity by nearly 40%. So that effect was greater than that of the depression in the mother. And paternal depression has what's known as epigenetic effects on the DNA of the baby. So, and those paternal genes can also affect placental function, making it not quite as efficient as it should be otherwise. And the children whose fathers also had PTSD, post-traumatic stress, they showed behavioural problems as well, but this was indirect and usually transmitted via the mother. Because if you think about it, living with a very irritable, withdrawn or terrified spouse is likely to impose a major psychological burden on the partner.
And what can we do to prevent these problems that you just mentioned that are not just within the mother, can also be within the father?
Okay. There's lots we can do, even particularly in the prenatal environment. There's loads we can do. We do need to take into account that war and trauma and poverty, malnutrition, neglect, racism, homophobia, misogyny all come from the decisions of people with emotional damage you can attribute to all of those adverse childhood experiences. But it can become an intergenerational pattern when it's not interrupted by loving, sensitive care and supportive witnessing. And this is where your Prenatal Alliance personnel can come in, because a supportive witness is a caring person who highlights to the victim that they should not receive abuse and that such abuse is neither normal nor acceptable. I'd love you all to read almost anything by Alice Miller. She's a wonderful psychotherapist. She describes trauma very clearly in the Drama of Being a Gifted Child or The Untouched Key, any of her books. So for long as these traumas continue, mental illness will continue to be created and it will endure. But we can each do we can each do what we can for the parents in our care once we have this understanding and a knowledge of what works. And I'm going to be talking more about the knowledge of what works further down. We can help to prevent and interrupt those cycles. We can be that supportive witness that stands up for the oppressed. It's part of the training to look out for signs of trauma in pregnant women. And I would encourage all the people watching this podcast to do so. And on top of that, we can learn more about nutrition. It's my field. It's a modifiable risk factor. It can be improved with targeted programs, in addition to programs to reduce maternal distress. And there's a reference for that in the information sheet that goes with this. I mean, for example, nearly 1 in 5 Australian women, and this isn't women in deprived areas, nearly 1 in 5 of the average Australian women begin pregnancy with iron deficiency. I mean, that's associated with prenatal depression. You don't need anything else, just an iron deficiency will do it. So there are a number of studies which show that, for example, omega-3 fatty acids from oily fish are proving to be extremely effective against major depressive disorder and other psychiatric disorders. You might have a look at the work of Dr. Georgia Ede and others. She's shown that a ketogenic diet, which is basically low carbohydrate, can be life-changing for people with even severe psychiatric disorders, such as bipolar disorder and schizophrenia. The health professionals in the Prenatal Alliance are likely to meet people with bipolar disorder and schizophrenia who are pregnant. So there are ways to help these people using food. We can help to set up or support groups or support self-help groups. And if you think about some of the other triggers for depression, it's often food and household insecurity, a lack of community and family support, and partner violence. So people who are in similar circumstances, who are in a group, can be relieved not to feel so alone. They can empathize with each other, and they're often the best support for each other. So especially in troubled times, we can refer on to community support groups and safe places. Another thing we can do is recommend yoga. 10 weeks of yoga practice markedly reduce the post-traumatic stress symptoms of people who've failed to respond to any medication or to any other treatment. So yoga helps to regain that relationship with the interior world, and with it, a caring, loving relationship with yourself and your own body. So that's enormously helpful. We can recommend breathing practices. So learning how to breathe calmly and remain in a state of relative physical relaxation, even while accessing maybe painful and perhaps horrifying memories. That's an essential tool for recovery. And the more you stay focused on your breathing, the more you benefit. And part of breathing, of course, is mindfulness. So practicing mindfulness, just thinking about exactly what you're doing, how you're holding things, what you're, how the room is around you, that can calm down that sympathetic nervous system, and it can lead to changes in the brain regions related to body awareness and fear, and enhance emotional regulation. So you can learn to observe and tolerate your physical reactions, and that's a prerequisite for safely revisiting the past, because when you're able to do that, you're less likely to be thrown into fight, flight, or freeze, and that sudden feeling that you're back in that situation. So if you can't tolerate what you're feeling right now, opening up to the past can risk compounding the misery and re-traumatizing you further. So mindfulness is a tool to decrease that hypervigilance of the brain's fire alarm system, the amygdala, and helps calm that down, decreases reactivity to potential triggers during any form of therapy and in everyday life. And leading on from mindfulness, we can recommend meditation. It does have a positive effect on exactly those brain areas that are critical for physiological self-regulation. Now, those are known as the insular, and again, that medial prefrontal cortex that can talk to the amygdala, the terrified bit inside the head. We can recommend exercises that incorporate movement, rhythm, and action. So there's yoga, but there's also Tai Chi and Qigong from China, and martial arts. Now, these, as you know, focus on the cultivation of purposeful movement and being centered in the present. Now, these are abilities that are damaged in traumatized individuals. So skills such as Aikido, Judo, Taekwondo, and Jiu-Jitsu, and Capoeira from Brazil, they're all examples. They all involve physical movement, controlled breathing, and a form of active present moment focus. So feeling the pleasure of taking effective action restores a sense of agency and a sense of being able to actively defend and protect themselves. Something that your skills staff may want to look at more is therapeutic touch and massage. So touch is the most elementary tool that we can call on. Some sort of body work, such as therapeutic massage, can be very helpful. Touch and movement grounds people and allows them to discover the tensions that are held for so long that they're not even aware of them. So when you're touched, you wake up to that part of your body that is being touched, and that can help let that tension go in a safe environment. And that can come into play in birth, which I'll talk about a little later. Music is a universal source of comfort and emotional release. We can even recommend drumming. Rhythmical drumming, to become both more present and relaxed, is found in nearly all cultures. And vagus nerve stimulation and soothing, that amazing vagus nerve that wanders down through our body. There's the emotional freedom technique, which is often known as tapping. So tapping works on the vagus nerve pathways that are also meridians in acupuncture. It's very easy to do and learn. There's websites and YouTube videos. I highly recommend that you have a look at those. And such ordinary things as humming, singing, gargling, blasts of cold water after a shower. All of these are all the following techniques promote ways to enhance a calm response to the autonomic nervous system that otherwise can drive anxiety. Another way that you could work with clients is encouraging them to take part in theatre. Love and hate, aggression and surrender, loyalty and betrayal are the stuff of theatre and the stuff of trauma. So tragedy in theatre revolves around coping with betrayal, assault, destruction. Conflict is central. So there's inner conflicts, interpersonal conflicts, family conflicts, social conflicts, and all their consequences. And while trauma is about trying to forget and hide how scared and enraged or helpless you are, theatre is about finding ways of telling the truth and conveying these deep truths to your audience.
I think it's wonderful that you brought you highlighted so many ways to resolve the problem, and I would say that a lot of the things that you just said are also ways to preventing trauma.
Absolutely.
Because this that you're talking about, it's not only for mothers and professionals, but it are also skills that one can have to
Yes.
understand themselves, to understand their path, from where did they come. And some of the things here in Prenatal Alliance that we hear a lot is about the trauma of the practitioners, the ones that are helping mothers, and
Yes.
that are also involved in, for instance, in experiences of trauma in the birth room, and they also have their own traumas, and then they re-traumatize themselves through the experience that they are living.
Yeah.
And these are wonderful tools to use, and with someone that has that setting that happened to, that is experienced that in their lives, but also to us human beings, to prevent ourselves or to transform trauma in our lives. So what can we do around birth?
Well, this is where the skills of Prenatal Alliance comes in. We can support each birth with minimal interventions. The positive interaction with the midwife has been shown to promote much better mental health during birth and in postnatal women. We can support the healthy microbiome. So see Tony Harmon's microbirth plan for more details on this. And we can support uninterrupted skin to skin while the baby's in hospital and beyond. And this and all the other preventions help to promote a secure attachment between the parent and the child. So the safer the child feels, the better their physiological and emotional development becomes. And our attachment bonds are our greatest protection against threat. So while all parents need all the help they can get to raise secure children, traumatized parents in particular need to be attuned to their children's needs. So skin to skin is one of the most reliable ways of fostering secure attachment for both parents and their infants. You'll be familiar with kangaroo care. It's now recommended for all mothers, but especially for premature babies and their parents. You can get skills to become a kangarooler using Niels Bergman and his wife's techniques. So that's amazing to really support kangaroo care well. You can gain more skills in effective breastfeeding support, so that that wonderful oxytocin and prolactin connection can get going. You can support effective long-term breastfeeding, so way beyond introduction of solids at 6 months, carry on the breastfeeding and support that going forward, because people still have issues later that you can help out with. We can recommend baby massage, probiotics and prebiotic foods for the mother. We can get more training. So therapeutic touch, for example, that has been researched and it supports much better labour outcomes.
So what professional or specialist resources might we be able to refer a client towards or suggest that they look into for themselves?
Okay, there are several. So one of the best for trauma is known as somatic trauma release. So that can help patients relocate themselves in the present by experiencing that it's safe to move, and feeling the pleasure of just taking effective action restores that sense of agency and, for example, a sense of being able to actively defend and protect themselves. One of the ghastly things that causes trauma is being in a life-threatening situation and you cannot get out. You cannot move, you cannot get out. You can't change it. And that's what is the most traumatizing thing. So restoring that sense of agency and being able to move is what helps people release that trauma. There's also neurofeedback. Clients can learn to produce relaxed alpha waves in 4 days using brain feedback techniques. And that significantly decreases post-traumatic stress symptoms, as well as all the physical complaints, depression, anxiety, and paranoia. So people who went through neurofeedback were less frantic, they slept better, they felt calmer and more focused, and they tended to stop drinking completely or using the drugs. And they ended up markedly less depressed, and they had less need to self-soothe with their toxin of choice. The other thing that's also found to be extremely useful, this is eye movement desensitization response, known as EMDR. So EMDR can help to resolve the symptoms of PTSD, and it seems to work in a similar way to dreams with their rapid eye movements. So dreams helped us to integrate, process, and move on from traumatic experiences so they're relegated to the past. EMDR, even though it's done when you're in a relaxed but awake state, that seems to work in a similar way, and it can be surprisingly effective. One of my favorites actually is internal family systems therapy. So at the core of that system is the notion that the mind of each of us is like a family in which the members each have different levels of maturity, excitability, wisdom, and held pain. So these parts form a network or a system in which change in any one part will affect all the others. They're all trying to protect the deepest, most hurt parts of the self that are often exiled with feelings of shame or horror and trauma. Sadly, some of this protection can be self-sabotaging, like going off drinking or using drugs, because they want to distract from anything that might lead to more awareness of that deep hurt. So this form of therapy can be used with teenagers and children, as well as adults and pregnant people, as a way of helping to help them understand themselves.
Yeah, because we are talking about trauma, and this is our topic, it can be a little bit overwhelming
Yeah,
for people. So in your practice, in your studies and research, do you think that there is still hope?
I do. And it's not just my thinking, it's also based on the research. The brain can remodel itself throughout life. This includes changes as a result of the way we think and the way we behave. And intention and attention, both of those create real physical effects in the brain on those neurotransmitters, on the synapses, on the growth patterns, and the neural networks. So health promoting, self-regulating networks can become stronger. It can be physically bigger, and awareness of emotions and parts of the body can become a normal part of life instead of being exiled and shut down. So once those protective defenses are no longer needed and it feels safe to do so, the true self can emerge, and it does.
And what else can we do, should we think about as maternal health care providers, or just as therapists that are working with pregnant couples?
Yeah. So it does help if we ask ourselves, I don't know whether you call them patients or clients, but so what are these patients trying to cope with? What are their strengths? What are their internal or external resources that they can use? How can they calm themselves down? How can they have caring relationships with their bodies And what do they do to cultivate that physical sense of power, vitality, and relaxation? And to think about who really knows them, loves them, and cares about them, and that they can be in touch with. So who can they count on when they're scared, when their babies are ill, or if they're sick themselves? Are they members of a community? Do they play a vital role in the lives of the people around them? Because that can be protective for themselves as well as the other people. Do they have this sense of purpose? What are they good at? How can we help them feel in charge of their lives?
Yeah, these are great questions to reflect upon when we are working with our clients or with our patients. And what do you think this mean for the wider world? And what should we take away from this talk?
Okay, well, they've done more research on this. So there was an economist called James Heckman. He won a Nobel Prize in economics for demonstrating the vast savings that are produced by early intervention in the lives of children from poor and troubled families. So there was more high school graduations, 70% less criminality, increased employment, decreased family and community violence. And study after study shows that having a good support network constitutes the single most powerful protection against being traumatized. So do you now see how important the work that you do is? So the way you show up every day, your skills, your kindness, your compassion, and your support, that may mean everything to a new family. And if you've come this far and listened, you have also become part of this support network with your clients. And I'm hoping that you're now feeling more knowledgeable about what you yourself can do to prevent and mitigate the potential for trauma in their lives, and maybe your own. You're not immune from trauma and difficulties. So I hope you are feeling better equipped to signpost your clients, not just to professional specialist resources, but also a range of effective life skills that once they know what works, they can do for themselves and you can do for yourselves too. Now, I am aware that I've given you an awful lot of information here, but you don't need to remember it all. There is an information sheet that you can download, print out and keep in your work bag as a memory jogger. So it can remind you of the various options to recommend when you're faced with a client who is struggling, or even if you've got those issues yourself.
Yes, and we will keep that in form sheet here on the description of this video, on this podcast.
Lovely.
And thank you so much, Liz. This has been such a wonderful talk, and it's and so uplifting, actually, regarding the trauma that can sometimes be very, very heavy. And where can people find you, find your work? Tell us all about it.
Okay, well, I am a trauma-informed practitioner, but like you, I'm not a trauma specialist. So today I'm doing what you will be doing. I am signposting you, I'm guiding you towards more resources on helping your clients and yourselves overcome trauma and have a happier life. However, if you have questions on nutrition in pregnancy, that really is my bag. If you've got a client with brain health issues, client with chronic illnesses such as diabetes, high blood pressure, gut issues, food allergies, autoimmune disease, maybe all of those at once. Now that is my speciality. I do deal with the tough stuff, but I can deal with the lighter stuff too. So please refer them to me, particularly if they want to avoid conventional drugs and use natural methods that tackle the root cause of the problems, not just the symptoms. I can offer them a complimentary 20-minute mini consultation, and you can take this up yourselves, of course. So if they decide they want to work with me, we can take it from there, and the same for you too. You can get in touch with me via my email, liz@lizmcgregorhealth.com, or my website, which is www.lizmcgregorhealth.com. So thank you so much for listening and taking this on board into your professional, personal lives. I would love you to go out there and feel more confident about helping your clients and yourselves whatever is going on for them and whatever is going on for you. So
Thank you
you.
so much, Liz. This was such a wonderful conversation. It was very knowledgeable, but not only for professionals, but also for mothers and couples who are also part of our audience. So I hope they had a wonderful time with us today. Thank you so much for accepting our invitation, and we'll keep all your links here on the video description. Thank you so much.
Lovely. Thank you too for this lovely opportunity. You're spreading the word, getting the knowledge out there. Thank you again.